Hi everyone, it's Karen here. Welcome to episode 4 of series 3 of Probably Nothing. I will quickly introduce myself because I say this at the beginning of every episode. So if you have watched Probably Nothing since series 1 in June, I am genuinely sorry that you've heard me say the introduction. I try and mix it up a little bit, but basically you've heard the same thing a dozen or so times now. So I'm sort of sorry for that, but I'm not sorry because if it's your first time tuning into Probably Nothing, you need to know what's the deal. So I'll tell you. My name is Karen Hobbs, but don't judge me. I'm a nice Karen, not a nasty Karen. And I run the Ask Eve information service with our amazing gynae nurse Tracy, who has been a guest on previous episodes. And it's a free and confidential information service. We'll put the details up at the end. And basically, we started Probably Nothing back in June because we were getting a lot of calls and emails from people who would say, sorry to bother you. This is probably nothing but, and then go on to ask their gynae cancer question or to explain the gynae health thing they were concerned about. And the good thing is that a lot of the time, with all of the symptoms of all 5 gynecological cancers, so womb, ovarian, cervical, vulval, and vaginal, most of the symptoms are going to be something less serious. They're not going to be cancer, but obviously, sometimes for some people, that probably nothing does unfortunately turn out to be something. So we wanted to create Probably Nothing, an online kind of chat show sort of thing, where each week I talk to someone about something, so a different topic each week with either a patient or medical professional, and we kind of answer common questions and go in depth in hopefully an easy, informative, accessible way about said topic. So I said it was going to be a short intro, didn't I? I think it's the longest ever. um, I normally do stand-up comedy, okay, and I'm starved of the stage, so here I am begging for attention in front of you. Um, but thank you. So the last few episodes, so series 3, has been centered around cervical screening because it was cervical cancer prevention week when we started the series in January. So we're carrying on with the theme for the rest of the series, and today is the last episode of series 3, and we've covered, and if you want to catch up on previous episodes that are all on our social media channels, we've covered kind of cervical screening 101, kind of what is cervical screening first week, then all about HPV the second week, and then last week what to do if you have symptoms of cervical cancer and kind of getting referred and seen by a gynecologist if you have an abnormal result, or if you have symptoms and need them to be investigated. So a lot of people who need to go for cervical screening. So that includes trans men, people who are non-binary, intersex. Basically, if you have a cervix, you are eligible for cervical screening. And for most people who do have cervical screening, it's fine. It's not all the fun at the fair. It's not the best experience ever. But for most people, it's not painful. It's just one of those things, I'll go for it because I've got the letter, but it's fine, just deal with it. But for some people, there are certain barriers that can make having cervical screening really difficult slash impossible. And we, of course, at the Eve Appeal encourage people to go for cervical screening because, you know, we are all about early detection, risk prediction, prevention. There's no other screening program for womb, ovarian, vaginal, or vulval cancers. It's just cervical screening. So, of course, I and Eve Appeal are encouraging of people to go for cervical screening because that's our job. But it is also our job to listen to people who have barriers, or a barrier or plural, as to why they are unable to attend their appointment or why attending that cervical screening appointment is difficult. Now, one of the barriers is vaginismus. And I'm not going to explain what that is because I have a wonderful guest who's going to do that for me. So I'm going to introduce my lovely guest. And also, she's called Lisa. She's not a medical expert, but neither am I. I'm not a nurse. Tracy's the nurse on the Ask Eve service. But Lisa has a very lived experience of vaginismus. And I think it's really important to make sure that when we're talking about certain topics to do with gynae health, experts, medical professionals are wonderful, have great answers, but it's also important to kind of see the real life lived experience of said topic. So, longest intro ever after I said I wouldn't do that. Shut up, Karen. Lisa Mackenzie, who runs the Vaginismus Network. In you come.
Hello, lovely. How are you?
Oh, I miss you. I wish we were doing this in person.
I know. I was thinking of you in the lead up to this actually, and I last saw you. Probably it was my last proper night out where we could touch people and hug people. Do you remember the book launch last March?
I did.
Karen
Yes, I did.
Gurney's.
Yes.
That was my
Another good
last night out
Karen.
out. Yeah, all Karens
I
are
think,
good.
do you know what? I think apart from a couple of gigs, I think that was one of my last actual socializing nights out. And it was perfect because it
Yeah,
was all about sex. We like to talk about vaginas, don't we, Lisa?
we do.
We
Yeah, I miss
do,
it
so
so
on brand.
much.
Oh, me too, darling. Can you tell me? So I said in the intro, and it was the longest intro ever, and I said I wouldn't do it, but oh well. So I said that we're going to talk about one of the barriers to cervical screening, which is vaginismus, but I didn't explain what it is at all because I would like you to just tell us what do you know what I actually bet unless people are watching this because they've seen the word vaginismus and want to know more about it because they think they might have it. I think this will be a
Sure.
lot the first time a lot of people will have heard of that word. I certainly hadn't heard of it at all before starting at ease because why would I? So can you just tell us like what on
Yeah.
earth it is?
Of course I can. So it's basically a psychosexual condition. And for the person with vaginismus, it means that upon any attempt at penetration, their vaginal muscles will involuntarily clamp up. So I always say this, I feel like a broken record, but people always think, oh, well, that's penis and vagina sex, then it's about the penis. But actually, it's much more than that. So it can impact someone's ability to have a cervical smear test. To wear a tampon if they're on their period. Absolutely anything can be impossible, difficult, painful to insert. So it could be my bloody little finger, anything. I'd say I always think there's a definitely kind of a spectrum of how it impacts somebody. So for some people, it could just be difficult thing to manage. For some, it's painful, incredibly painful, or for some, it's just impossible. And there's two main types of vaginismus. So primary vaginismus, that's the camp that I fell in when I struggled with it for many years. And it's basically where penetration's always been an issue for the individual. So it will normally become apparent when somebody maybe starts their period and tries to insert a tampon for the first time and they find it difficult. Or they become sexually active and try to have penetrative sex. And again, that is clearly an issue. And then secondary vaginismus is a bit different. So that can impact any person at any point in their life, any person with a vagina, sorry. It can impact someone after, they've never had an issue with penetration. So they might have had a very comfortable, healthy, enjoyable sex life, for instance, and then something might happen to bring it on. So it could be sexual assault or trauma. It could be a difficult childbirth experience. I did know somebody actually who developed secondary vaginismus after undergoing treatment for gynecological cancer. So there's a whole range of reasons around secondary vaginismus. I was also reading up recently about situational and universal. So situational, it might be, I guess, if somebody maybe has experienced sexual assault, then penetration, penis and vagina penetration is the issue, but actually they might be fine putting a tampon in, for instance, whereas universal is any kind of penetration is an issue. So yeah, they're the kind of main types. The statistic that's kind of battered around a lot is that 1 in every 500 women will experience vaginismus, but we always say it's got to be much higher than that because a lot of people feel ashamed and embarrassed when they're dealing with it and living with it. So I think it's definitely underreported. When people do sometimes visit their GP, they may be misdiagnosed. There's brilliant GPs out there as well, but sometimes people are told, just relax and have a glass of wine, it'll be fine. And also, I always say, and I don't have the evidence to prove this, but actually that 1 in 500, I reckon it's probably cisgender women. We're not including, trans males, for instance, or people who are non-binary. So I feel like it's much, much higher.
Of course. And so that's so interesting because I knew, what vaginismus meant in terms of, the involuntary tightening of the vaginal muscles upon penetration. That, can mean tampon, finger, penis, speculum, many different things. But I really didn't know about the two different types. So kind of the type one,
Okay.
which is, someone will realize when it comes to the point in their life where they do insert something into their vagina, like a tampon, when starting period, or a penis if having penis and vagina sex. And then type two, it being something that comes on later in life because of something happening. So I didn't know about the two different types. That's really interesting. How you mentioned sometimes people are misdiagnosed and kind of told, oh, have a glass of wine or whatever, which is so eye-rolling,
I
frustrating. But
know it's just
yeah,
become this almost joke thing that people just say, but they're told it so often, and it's just like you say, such an eye-rolling thing to
such a
hear,
shame.
but it
How
happens.
it happens, yeah. How is it diagnosed? So if somebody, say, is 35 and is kind of thinking that, do you know what, for a damn long time it's really hurt when I've tried to have sex with my boyfriend. How do you go from that to saying, hi, I'm Karen and I have vaginismus? Like, what's the kind of bit in between?
Yeah, there's because I guess it's a tricky one to diagnose because it's not like you can go and have a blood test or something and it's kind of
Yeah,
clear cut. Um, I would always, despite saying that some GPs don't really understand what it is or might misdiagnose, I would never want to prevent somebody from trying to get that official diagnosis. So I would always say, if you feel confident and comfortable enough, do visit your GP and try and get that diagnosis. I wasn't diagnosed by that route, but I believe they ask for a bit about your sexual history to maybe understand, if there was any experience of sexual assault, for instance. They will do a pelvic examination, which obviously by nature can be a difficult thing
yeah,
anyway.
yeah,
So sort of doesn't really make sense. And also they might rule out other things, so like a yeast infection, for example. So I'd always say if you feel comfortable having that conversation and trying to get that official diagnosis, then definitely go to your GP. For me, I was diagnosed, I would say, through psychosexual therapy. So I started seeing a psychosexual therapist when I'd heard of vaginismus, but I was saying, no, 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 I don't want to be associated with that. Thank you very much. But I knew there was something going on. So I was sort of in denial. And it was through the therapy process that my therapist kind of, took a very comprehensive account of my history and obviously got to know me and my experiences. And eventually we talked about vaginismus and realized that this is the issue. I do hear from people who diagnose themselves, self-diagnose. So I would never recommend that because obviously we're not professionals, but I would also say, your body, and
yeah,
actually if you're visiting your GP and you aren't getting the response that you want, or sometimes you hear about people visiting a GP and you say that they say the word vaginismus and they might Google it in front of you or kind of just look at you with a blank stare. So
yeah.
you might try that route and you might find you're not getting what you want. And actually, your body, you can do your research, you can read up about, vaginismus and other conditions through useful resources. So I do know some people who have self-diagnosed as well. So yeah, it's not clear cut. And like I say, it's not like you can just get a blood test and there you go, it's confirmed.
Of course, of course. And do you think because it's not like it's so a kind of, I guess the umbrella for this series is cervical screening. And with cervical screening, the sample is tested for HPV and then checked for abnormal cells. It's very kind of, it is clear cut, but something like vaginismus is sort of more, there's more speculation around it, isn't there? So do you think that's why sometimes people, as you said at the beginning, kind of feel maybe a bit of shame around it, because it's something that we hear this a lot. People are often told by doctors that, and it's a real shame that kind of like similar to the glass of wine thing, but not that they're making it up, but kind of, just relax. And they don't kind of, because it's not a yes or no answer, like, do you have HPV, yes or no? It can add a lot of stress. And already when it's something to do with kind of sort of psychosexual and around tightening of the vagina, that's quite a stressful situation as it is. So I can imagine to then be told, it kind of, to dismiss that can can add more shame and maybe make you sort of retract and not be kind of as able to seek help.
Yeah, I completely agree. And I feel with the whole GP thing, I feel like there's amazing professionals out there, and you're lucky if you get one of them, and it shouldn't be the case, because unfortunately, I think a lot of people, in addition to the shame that they feel and embarrassment around, especially growing up as a young girl with something like vaginismus, there's a whole lot of mental impact that goes on as well. You then think, right, if I go to my GP about it, what if they don't understand what it is? What if I am misdiagnosed or treated flippantly? And I know of people who have had that experience, and then they haven't bothered trying to, like you say, they've retreated, so they haven't bothered to go and see a different GP or kind of force the issue. And I just think that is so detrimental, because they could have, if they'd seen the right GP and been met with empathy and compassion and understanding what the bloody issue is in the first place, then they can kind of set themselves on a path to, overcoming it or getting the right treatment. But if you don't get that experience, it could really impact your progress. Like, you might not do anything about it for many years. So it's definitely, I just wish people could go to the doctors knowing that they will be met with understanding, knowledge, compassion, but it's a real kind of mixed bag.
Cool. And say whatever route you've taken, whether it's kind of psychosexual therapy that you've sought out because you've done your own research, believe you have vaginismus, and think, okay, I found a psychosexual therapist, I'm going to pay to go and talk to them, and that's how I'm going to start my kind of journey with trying to look into what's going on. Or say the GP has said, yeah, we reckon this is it. Is it, I don't know, is this a silly question? Can it be cured, or is it something that when one has vaginismus, it's you have it now, but we manage it, or does it go away? Or what do you do if you're, is there an object that you use to treat it? What happens?
Yeah, there's two things going through my head there. So in terms of treatment, there's definitely lots of options out there. So as I said, I personally saw a psychosexual therapist, and through that process, she introduced me to dilators. I'm sure you've seen them at Shush, Karen, and know about them. But essentially, for people who don't know what dilators are, I don't ever describe these very well. I call them silicone sticks, but they're kind of like sticks that gradually increase in size, and mine is a set of 4, and you basically just use them to get your vagina comfortable and used to having something penetrate it. Dilating definitely worked for me, but it's a process that definitely requires a lot of patience and perseverance. And I would always say, if you're going to take that route, do not compare yourself to anybody, because I used to read up about people who, bought a set of dilators and within 5 months they were using the biggest one. And I was like, oh my God, I still can't insert the smallest one. And it's been 4 months. But we've got a series on dilating on Instagram, actually, we've been working with the psychosexual therapist, Kate Moyle. And there's loads of different tips on there. So if you are thinking of dilating, go and have a look. It's not a one size fits all, but there might be a couple of things that maybe will help you with the process. I've heard of people who have had CBT as well, pelvic floor therapy. I've also heard of, and I always say, like, I'd be ignorant not to mention this, but I've got mixed feelings about it. But I've heard of people who've had Botox to treat vaginismus. Now, I don't know enough about it to, have a very comprehensive view, but I feel like a bit girl when I think about it, because for me personally, it feels a bit like putting a plaster on the problem, and maybe not really dealing with the mental kind of side of it. But I do know it has worked for some people, so that's an option as well. And then there's lots of things to consider. This is going to sound really corny, Karen, so just ignore me. But
go for it. Go on.
I think so. I always say this: there's different treatments out there. For me, it was dilating and psychosexual therapy. But what really made the difference for me was actually communicating about the problem and talking about it, because that allowed me to take back control. And then through that process, I met other people who were struggling with the same thing as well. And that definitely meant that my progress accelerated, because I got more confident and comfortable in myself. It was no longer something that was controlling me. It was just something that I was, dealing with and managing. So yeah, it sounds bloody corny, but communication is key, I think.
Of course. And so can you just tell us a bit about the Vaginismus Network and kind of why you set it up, and kind of what you found, kind of things that have come from it, that, kind of common things that people talk about that are really sort of shared experiences, that sort of thing.
Yeah, and I realised I didn't answer the second part of your question, so I can probably link it in here, because a question we get,
yeah.
a question, do you like my little linkage? A question we get a lot is, how will I be cured? When will I be cured? And I always say to people, I think you asked about, can people be cured, or what does it mean? I always say to people, what does it mean to you? Because I think people might look at cured in quite a black and white way and think, right, got to be able to have penetrative sex and then I've overcome vaginismus. I'd go beyond that and say, well, actually, was it comfortable? Did you enjoy it? Pleasure is bloody everything. Did you enjoy it? But also, for me, cured is not necessarily that. So I say to people, for me, cured means that it doesn't control me anymore. I control it. I know in the future, if I'm going to have penetrative sex with somebody, I'll probably always have that little niggle that goes, oh, is this going to be a little bit painful or uncomfortable, or will it be fine? But I'm actually okay with that, because I think I personally realized that I could spend my life thinking I've always got to have comfortable penetrative sex, and that means cured. And then I'll be perpetually disappointed, because I realistically think that might not be a thing for me, but I'm fine with it as long as I talk about it. I don't put myself under any pressure or pain. So I'd always kind of think, what does cured mean for you, and kind of reframe that a little bit. Totally going off on a tangent now. I tend to do that. What was your other question?
But that what you just said about how it's kind of about, you would consider not being cured, but kind of the point where progress has been made when Lisa, who has vaginismus, goes to have penetrative sex and is in control of the situation, and it's not, the experience isn't being ruled by this pain. But I was looking through our Ask Eve service, and people that have mentioned vaginismus in our conversations with them, and someone saying that she's just, when it comes to anything from penis to tampon, she now just expects pain. And our mind is, we know it, is so powerful in terms of good, but also in terms of bad, that if I I've touch wood, not had problems with penetration and pain and kind of involuntary tightening, but if I went to have sex and thought this is going to hurt, it will hurt, because I've told myself I'm come to expect it. And you can kind of I'm not surprised you kind of talk about the curing side of it actually being about more when you're in control of the situation rather than letting the condition rule your vagina rather than you kind of working alongside it.
Yeah, definitely. And the control thing is so empowering. And I think definitely has helped me so much because, now it's a case of, okay, this might be uncomfortable, maybe it's painful. I will stop. I won't put myself through something that actually is going to cause me discomfort anymore. I will have sex in other ways. I can be a sexual person in other ways, whilst penetration is maybe difficult. And I think in the past, I definitely in my sex life put up with pain and discomfort because I felt like I was the only person in the world with vaginismus, and many people say the same thing because you feel broken, you feel like I can't do this thing that everyone around me is supposedly doing. And that meant for me personally that I overcompensated. So when I was with my first boyfriend, we didn't communicate about the issue. And I definitely felt that I had to prove to him that I was a proper woman and I wasn't giving you this. So I'm going to give you all these other things. And if it hurts, I'll just accept it because I'm not, I'm kind of the smaller one in the relationship, which sounds really negative, but that's how I felt. So now for me, I'm in control. I talk about it. I don't accept pain or discomfort. And I can enjoy sex in a wealth of ways. It's not just about that. That's one option. So yeah, it's definitely the control thing, like you say.
And well, now we all went off on a tangent, all of us, all three. The second half to the other question was about the network that you set up and
Yes.
kind of what it is, what's good about it, why you set it up.
Yeah, I set it up so I'd been not really talking to anybody about vaginismus. I spoke to my therapist and a couple of friends, and then I found this online blogger called Kat Wilson who talked about vaginismus. And until I found her account, everything that I read about the condition personally for me was a bit clinical or disempowering or quite kind of one size fits all. And I'm never undermining, the massive impact it can have on your life. Bloody hell, like it impacted my life for so many years. But also as a young girl growing up with a condition, you don't want it to be all doom and gloom. And what I loved about Kat's blog was she kind of laughed at herself and the experience. And you're a comedian, you know this. Humor just helps everything. So,
of course it does.
and I was just drawn to her style. And anyway, we met up quite quickly, and it was so life-changing to be, sitting in person with this other woman who has experienced exactly the same thing as me. I'd lived many years never talking about it. It was all in my head. And it was amazing because I was venting about it and talking about how it impacted my life. And she was just nodding along and rolling her eyes. And I guess from that experience, we felt so empowered. And we said, surely we can do something here to connect other people with the condition as well, because it felt like a real life-changing moment, just to talk to someone who understands what you're going through. So yeah, we set the network up really with that focus in mind, just to connect other people with the condition. And when we do that, we also wanted to, I guess, similar to Kat's blog and kind of our styles, we wanted to put something out that was empowering to individuals, human, educational as well. I always try and involve people as well, because I think it's such a powerful thing when you finally find your voice and tell your story, being corny again.
Yeah, no, I hate that. So whenever I talk about
here's my story.
Exactly. Share your experience. Talk about your journey. It's like, oh, shut up.
But it's so true. And we have a blogging platform where people can talk about their experiences. We run events where, it's not all about me and Kat. We get people to come and talk about their experiences and share their stories. And it's just it's a really empowering thing. And we've definitely built up this community of women and people with vaginismus. So I think suddenly feel quite ignited, and they're like, yeah, I want to be heard, I want to be involved, I want to speak to other people about this. It does not define me. And it's wonderful just seeing people, sharing tips and being there for each other as well. So yeah, it's been a real positive.
I often, because of course, as I say, not medical experts, but neither am I yet. Here we are. Whenever people contact Ask Eve and ask, whatever question they're going to ask, and then they mention vaginismus and what can be done, and I can tell them what the options are in terms of managing, so like therapy, dilators, etc. But I always also send them the link to the Vaginismus, I was going to say the Vag Network. I'm not being casual with my language. You'll see when we put the handle up at the end, but that's why I'm saying the Vag Network. It's short for Vaginismus Network. Because I always send them the links. I think you can have any information service telling you these are the options. You can have any GP being understanding. You can have any therapist talking to you about the trauma that might have started all of this off. But I think there's something there's often not a lot more powerful than talking to someone that's just gone through the exact same thing you're going through. I think the power in that and the benefits of that are, they can often rival, a diagnosis from a medical professional. Obviously you need we need the medical experts, desperately, but on balance, having someone to just simply talk to peer to peer, I guess, I think is not anything to be sniffed at.
Yeah, and that's why, we haven't run one since March last year or before, but that's why the in-person events are really powerful. So we run them at Shush, who I know you know and love, and just for people to attend the event having never really spoken about vaginismus or their vagina or sex, and to be in this really wonderful sex shop is amazing. And then for me, I think it's wonderful just to look around the room, and this is going to sound corny again. I'm on a corny roll today, but
it's Monday. Who cares? Just do it.
Just to look around the room and see all these amazing people who, they're interesting, they're funny, they're kind, they're brilliant people who just happen to have this common condition, but actually it's empowering to see them and think, yeah, this isn't controlling it. This isn't controlling us, sorry, bugger off. It's so empowering, those events. And my friend, I always laugh at this. I've got a lovely friend, Anne-Sophie, and she insisted on coming to our very first event. She doesn't have vaginismus, but she just wanted to support me. And I remember after the event, we were getting a tube home, and there was two other girls at the event that we met, and she just said, I want to have vaginismus. And I was like, Anne-Sophie, like, you know what you're saying. I don't think you want to have vaginismus. And she was like, no, but I want to be part of this gang. You're all cool and it's fun. But I always remember that. I'm just like, no, you don't want vaginismus.
You don't want it. Like it's nice that there's a supportive community, but you don't actually want the problem.
Yeah.
Lisa, so obviously, because of everything we've spoken about with vaginismus, it is no surprise that people with vaginismus might not attend their cervical screening or find it really difficult, which is a lot of the time when people contact Ask Eve and mention vaginismus, it's in that context, because they, just putting out a couple of things. I've been avoiding my smear test for 2 years. I'm overdue one, and keep ignoring the letters, or the last one was painful, so I'm avoiding the next one, or I haven't had penetrative sex because I've got, so I don't want to go for a screening. Does this come up a lot within the network, the community you've built? Do people kind of want to talk about kind of when it comes to medical examinations and cervical screening, etc.? Is that kind of a topic that comes up a lot in the community?
To be honest, it does come up sometimes, but I think a lot of people are kind of in denial about it as well. So do not quote me on this. This is not an official stat or anything, but I reckon maybe like 7 out of 10 people I speak to with vaginismus probably haven't had a smear test, because there's just so much that comes with it. And for me personally, so I kind of said to you before this conversation, I feel a bit vulnerable saying this, but I think it's important to share our own experiences. But I'm in my mid-30s and I'm yet to have a smear test. I was actually mentally ready before COVID. I promise you, this is not an excuse. But I don't fancy, I know that they're still doing them now, but I don't fancy having like the extra kind of clinical environment of masks and everything when
sure.
I'm having my first one. So yeah, it's definitely something I think, whilst I've been fine with penetration for a long time now, mentally, when you've avoided something like a smear test for so long, it can become this kind of big beast in your mind. And for me, I was obviously 25 when and they caused me quite a lot of anxiety and distress, because I hadn't spoken to anyone about vaginismus. I didn't really have a diagnosis or a word for it. And every time a letter came through, I felt like, oh my God, I'm being found out. And no. And I just rip it up and, put it away. And when I visited doctors, I dreaded the little box popping up and the question, and I became such a good actress. I was like, oh God, I'm such a scatterbrain. I'll put it on the to-do list. Don't worry. It's been a while, but it's fine. But actually, I think that was kind of, that process was not really challenged, actually, because there was a period in my life, maybe 5 years ago, where I went to the doctors probably monthly just because of something. And the smear chats kind of came up, but they made it easy for me because I just said, oh yeah, I'll sort it. And I was thinking, actually, before our conversation, had they said to me, oh, actually, you've been coming, to see us for a few months now, and you keep saying you're going to do it, but you haven't booked one. Is there something else going on? I think I might have maybe opened up, but I was never really challenged. So I personally didn't want to. And yeah, I guess it just, the longer it went on, it became like this bigger beast. And it's definitely an issue for many people with vaginismus. So I guess there's many things that are kind of going on. First of all, so many people with vaginismus have never spoken to anybody about it, and they feel like I said, they're the only one in the world feeling that way. They feel ashamed about it. So they're going to avoid things like smears, because that's just like kind of shining a light on the issue. Also, again, the point around GPs, and there's some wonderful ones, but also you don't know kind of what you're going to be met with. So again, I think that puts people off a little bit. People have obviously spoken about, not having one, because I guess for anybody, it can be quite a nerve-wracking thing to do. You feel a bit uncomfortable or embarrassed, but there's the extra layer with conditions like vaginismus and other things as well, where that it's probably going to be painful, and for some people traumatic. So why would you again want to put yourself through that? I think a big thing is, so actually I've got a great link I can send you, but I think a lot of people see it as quite black and white. So you go in, you put your legs up in the stirrups, you use the one size speculum is used on you, and that's it. But actually, I think people don't realize that you have choice and control in it. And actually, it doesn't have to be a process that is carried out on you. Actually, it's something that you can control. So there's a wonderful guide that the psychosexual therapist Sarah Berry pulled together for the Vaginismus Network, and it's on our website. And it talks about, a whole range of things to consider, like, do you want to book a double appointment if you need more time? Asked to maybe practice with a speculum at home, first of all. There are different sizes. Use lube. Use lube. Sarah talks about
in everything in your life.
Everything.
Use food. Yeah.
Lube is the best. And Sarah talks about things like some people actually prefer to lie on the side in the fetal position.
Yeah.
Do you want the lights to be dimmed because actually it feels quite clinical? Do you want the person to talk you through while they're carrying the procedure out on you, or would you rather they don't? There's loads of considerations like this. And for me personally, I know that when I go for my in-person smear, I'm going to ask for a double appointment. I'm going to ask for a smaller speculum. I'm going to ask for X, Y, and Z. And that makes me feel really in control. But I think people don't realize that they have the option, or they're afraid to ask as well.
I completely agree. I think we receive the letter and think, okay, I have to go for this appointment so I don't get cervical cancer. Oh, the procedure is going to happen to me. The test is going to be carried out. I've got to do it. And I think, yeah, kind of as I said at the beginning, of course, everyone's coming at this conversation from a different position, aren't they? Because we've all got different lived experiences. And I of course, I want you to have a cervical screening. Does Karen want Lisa to have a cervical screening? Of course I do, because I've had the disease and I want you to have the screening that prevents you from it. But in that same breath, of course, I want you to have it, but I completely understand why you haven't up until now. And I understand that as Karen, but I also understand that as kind of the Eva pill and Ask Eve. We know it's our job to encourage people because it's cancer prevention, which is what we're about. But that doesn't mean, going back to what I said at the beginning, that we can't respect someone's choice to not go. And when with the nurse service with Ask Eve, when people we talk to people who it's maybe they haven't started their therapy yet, maybe they haven't started using dilators, or however they're going to approach kind of managing their vaginismus. They say, oh, I haven't gone for my I've got vaginismus and I haven't started doing it yet, and I just can't face going for my smear. And you know what, okay, we'll just wait for a bit then. It's okay. Of course we want you to go, but it is also okay if you need to wait a little bit because because the examination is impossible. It's okay to delay it while you try and manage what vaginismus is causing you, like the pain upon penetration. It's all right to wait a little bit. Obviously, it's not ideal, but it is safe often if you've got a clear history to wait a little bit. That's why in COVID, because screening appointments have been delayed, it's okay if they're postponed for a little bit, as long as someone's history has been clear so far. But just to say, if you're overdue your screening, and don't panic if think, oh god, this appointment should have been 4 months ago. It's okay to wait a little bit, but if you're ever unsure about symptoms, so I guess my point is, if you're kind of managing your vaginismus and therefore delaying your cervical screening by however long, okay, that will probably be fine in terms of abnormal results. But it's really important to be a kind of symptom aware. So we've got loads of information on our website and on our social media channels. And if you ever have any potential symptoms, so bleeding in between periods, bleeding after sex, bleeding after the menopause, an unusual discharge, they're the things not to ignore. So yeah, it's most of the time going to be fine if you delay appointments screening wise, even though we of course still encourage you to go to be on the safe side. But symptom awareness, if you're not going for your smear, is the thing to kind of look out for there, which obviously already. But like you said, there are so many different ways to make an appointment easier if you are able to go. So when you, as you said, when you do go, when you can, when it's not going to be kind of as clinical a setting because of the pandemic, that you can ask for the longer appointments. But people don't realize that, do they? And people don't realize that but we put some resources together in terms of the kind of the trans, non-binary and intersex communities, but obviously it applies to anyone with this particular issue. But you can have the speculum in your hand and put it in your vagina. It's not something that has to be done to you, because often people that have gone through obviously sexual assault have the kind of, it's the fact that someone's doing this to them, it's the control element that is understandably,
Yeah,
of course it's
it's a big
understandable, a
thing.
massive barrier. So I think it's really encouraging that you know what you can do to make the appointment easier for yourself. And would you kind of just advise others to look into kind of how, from various resources, how they can make it easier for themselves?
Yeah, I think it's a game changer in the process because you are able to tailor it more to your needs. And I think don't be afraid to ask for that. And I think many people just don't realize. And I'd say for me, I'm thinking, right, when I have my in-person smear post COVID, I will be feeling slightly uncomfortable and nervous, but actually I've realized that's kind of a normal level. It's not fear anymore that I used to have. And I think if you're still up there and it could cause you trauma, then I will probably maybe think through what some of you said, recognizing the other symptoms and maybe not doing it until you're in a mentally better place. But I'd say I've just noticed a shift and actually I'm not fearful anymore. I'm just, oh, it's going to be a little bit nerve wracking, but it's fine, and I've got options. So yeah, I'd definitely recommend looking at your guys' resources and also the smear test guide that Sarah Berry pulled together, and just knowing that you are in control and you do have choices.
I really respect that you're saying it's about where you as an individual are at in terms of, here I go again saying the word journey. I hate that word, don't we, Lisa? But in terms of your journey, it's I feel like I'm such an idiot, but I'm gonna say it again anyway. In terms of your journey is where
I
you're at.
say it all the time, and I'm like, oh,
Fine. We're
yeah.
we're both embarrassing ourselves hideously, but it's you know that through the work you've done on your own kind of situation with vaginismus, you know that you will be able to go for a cervical screening test when the time comes up after COVID. You want to wait, as I said, appointments are still happening. Always check with your GP if you're not sure, but at the moment Lisa's choosing to wait a bit longer because of
Mm-hmm.
course you, the patient, and medical professional are wearing, extra protection masks and so on, which of course is going to make the situation feel more clinical. So that's why you're waiting. And we talk about
I
kind of
did though,
weighing.
Karen, to interrupt you. Sorry, I did
Yeah,
recently. I haven't used it yet, but I did purchase an at-home kit. So it was from Superdrug, and it's a swab. I believe from my research, they're reliable. If it comes back HPV, sorry, positive, then you're put in touch with your doctor. But I thought that might be quite, reassuring to do in the meantime. So I'll report back to you on it because I haven't used it yet.
I expect to get a very thorough message. We really support at the Eve Appeal kind of the development of home testing. So it's not NHS available yet, but you can buy kits at the moment, and so far so good. They're proven to be sensitive in terms of they're effective, and the results seem to be
Yeah.
correct and that sort of thing. So we kind of, again, of course, always respecting why, but we really support how screening can be encouraged in whatever capacity. So if that means starting off with a home sample that is going to give you the correct result, brilliant. Bring it on. We can't wait for that to be rolled out more and more. I wanted to just touch upon kind of weighing up the risks and benefits. So of course, cervical screening, we want people to go because it detects HPV that could cause cells to become abnormal, which could, if left untreated, develop into cervical cancer. But it is also about weighing up, apart from the benefits on your cervical health, the benefits on kind of your mental health and the trauma you've gone through, hence the vaginismus situation in the first place. Like, it's if HPV is passed on through any type of sexual contact. So if someone contacts us and realized they had vaginismus when they were 13 and tried to insert a tampon, and since then has never had any type of sexual contact at all, and the thought of having a cervical screening is unbearable beyond belief, then this
Yeah.
person is at a lower risk of cervical changes. So
Yes.
we understand and do support their choice to not attend, and that is, I think it's really important that we're having this kind of I've probably repeated myself a million times, but this sort of dialogue about it being your choice and people
Yes.
kind of respecting decisions. And, whilst we want to encourage, we do respect that and only want to be supportive of someone's choices not to, but equally in the same breath, providing information about the benefits of the screening, because that's a fact as well. But it's also a fact that some people aren't able to go at the moment.
Yeah, absolutely. I think choice is key. And I feel like, so I think some of the information that's put out there can be a little bit, not damaging, that's probably the wrong word, but I mentioned this to you before. As someone who hasn't had a smear test, when I see messages like "don't fear the smear," I have such mixed feelings, because on the one hand, I think, God, this is so empowering. It's such a positive campaign. It must help so many people. But then on the other hand, as someone who hasn't had one yet, it does make me feel a bit stupid, because I think, oh, okay, don't fear it, just get over it and do it then. And it's quite frustrating as well, because it's not that simple for people with vaginismus, but also wider conditions and things that you've mentioned as well. So I don't know what point I'm trying to make here. I'm going on a bloody tangent as well. But I think the information that's out there can also have an impact on how the individual feels. And actually, things like that might make you retreat a bit more and think, oh God, I feel really stupid and embarrassed, and I can't tell anyone that I haven't had a smear test, because you're not supposed to fear it, it's fine. And things like, the letter and the leaflet that comes through. I was looking at one, a friend shared one with me recently, and it kind of says it might be, you might experience discomfort, but it will pass. But for some people, it won't pass. And I think it's just kind of acknowledging wider issues as well.
I completely agree. Acknowledging wider issues, and as kind of looping back, because we'll wrap up in a sec, but kind of looping back to the beginning when I said for most people who go for cervical screening, it will be fine, a bit uncomfy,
Yeah.
but that's it. So I understand, that lots of people will see kind of the kind of quite light-hearted messaging of, come on everyone, let's just go for your screening, and they'll be like, oh yeah, I need to book, and they'll book it, and then that's that, and yay, that campaign or that message has done its job. But we also need to respect that the kind of the general majority, probably quite light-hearted tone of all of that stuff can sometimes have a detrimental effect when it comes to kind of more kind of deep-rooted reasons why someone isn't attending. So I think it like you were like, it's just about communication. It is just about communication, isn't it? It's about just talking, sharing information, and being respectful of people's choices. Lisa, thank you. Can you just give 3 quick tips to say if someone thinks they might have vaginismus, and what do they do? So they've not had anything diagnosed, they've just started on this, I think, sex hurting, they might have vaginismus. What kind of 3 bullet points would you say to someone?
Firstly, I would say, despite the kind of, I've said you do sometimes get a mixed bag approach with GPs. So some will understand, some will not know what you're talking about, some might misdiagnose. I would say try and go down that route initially, because they can rule out other things. And I think it's good to get that official diagnosis. So I would say, if you feel confident and comfortable enough, then take that route. I would say, this, I'm not blowing my own trumpet, Karen, but I'd say, come and join the Vaginismus Network.
Because I would too. I send people
I just
to you.
think,
So where can they find you? Because I send people to you.
yes, I just think, the feedback we get is actually, it's amazing to connect with like-minded individuals. It feels empowering. There's a lot of resources on there, because I'm one person with my own experience. It's a complex thing to deal with. So there's blog posts by different people on there. It's a very supportive community, and it can really help break down some of the stigma and shame that comes with the condition. So yeah, definitely visit a GP if you're able to. Join the Vaginismus Network. And I would say communication, there we go again. But I would say talk to people about it, because that's the only way you start to take back control of the situation. And I went for so long not talking to anybody about it, and it definitely had a really wide impact on different parts of my life. And I think talking about it, you feel lighter, you feel more understood. Talking to like-minded individuals who are going through the same thing, there's nothing quite like it. But also opening up to your friends about it, because I I didn't talk to my friends about it for so long, and you'll laugh, but I was always the mate, when you're at the bar or something and everyone's like, oh, should we get another round of drinks? And I'm like, oh, I'm just going to go to the toilet. Or sorry, I always offer to get another round of drinks or go to the toilet when they
Yeah.
talk about sex and stuff. Um, so there was always kind of a bit of awkwardness. But now when I meet up with my mates, like I talk about vaginismus, they talk about their annoying husband or IBS or whatever. And it just normalizes it. It's another step in normalizing it. So I guess they'd be my waffly tips.
Oh, I mean, we've waffled for the whole episode, so why on earth did I think the 3 tips were going to be short and sweet either? How would I? Lisa from the Vaginismus Network, thank you so much. I think that was a beyond helpful and enlightening chat about one of the reasons, one of the barriers that people don't go for their screening. So thank you so, so much. Oh, isn't she brilliant? So the Vaginismus Network, the website address was going along the bottom, vaginismusnetwork.com, and they can also be found on Instagram at the Vag Network. Thank you so, so much to everybody that watched. We'll put this episode up on all of our social media channels so you can catch up whenever you like. That is the end of series 3. The whole series is done. The episode's done. The series is done. So thank you so much for tuning in to one or however many episodes you've watched. We'll be back in March, which is Ovarian Cancer Awareness Month, with series 4. And in the meantime, if you've ever got a question and you want to talk to Tracy or myself at Ask Eve, please get in touch and just send an email over to nurse@eveappeal.org.uk. Thanks so much for watching and stay safe.